This is a conversation between Thomas Robinson, the nurse, and Aisha Diamande, the journalist. We will be discussing the topic on burnout and how it pertains to the healthcare community. We will be diving into the topic of what are the leading factors of burnout and what are the effects of burnout.
You if you work 3 to 4 days in a row, 12-hour shifts, that's exhausting physically, mentally. I mean, if when I work 3 shifts in a row, on day three, I am straight up running on fumes. I'm exhausted. I mean, I've just got, I got my butt kicked the last 2 days, and now coming in for another 12-hour shift. Like, they are long days, and there's no coming whatever comes through those doors. So, and most days, especially at Stony Brook, I mean, we get the hell beat out of us. So it's exhausting. So I would say that mental health wise, it can absolutely be tiring to work those shifts over and over and over again. Um, I would say on like the day shift, it's a lot easier than on something like the night shift, though.
Robinson has been an emergency room RN for 5 years at Stony Brook Hospital. He has not fully felt the effects of burnout, but he is slowly, gradually experiencing burnout.
I honestly, I don't get me wrong, especially in recent months, I definitely think that I am feeling that level of burnout more and more.
Mhm.
But I don't think that it's affecting me yet to the point where it's truly impacting my ability to care for my patients. I will say I think I have a better mindset now for when a problematic situation is going to come up where somebody is just like, no matter what I do, no matter how polite I am, no matter how foresight, like how much foresight that I have, somebody's gonna be able to find something wrong with what we're doing. And I think for those people, I'm definitely less like, what's the right word? I think I'm less patient, or not patient, because I don't get short with anybody really, but I think I'm less like willing to put the extra effort in to try to turn you to my side. So I think in that regard, maybe, but I think those are with, like, that's a very small population of people.
Mm.
And honestly, for right now, I can see myself burning a little more every day, but I think right now it's not really affecting me as of yet.
What are some of the biggest challenges you face on your in your role on a daily basis?
Uh, some of the challenges, I would say, I think I think that I think in general people, their tempers are just super like short fused these days, and I think with the arrival of a lot of things like just involving or evolving technologies, and faster and faster and faster responses, that they expect to come into an emergency room and experience like a very in and out, very quick answers are always there, and like very like no wait times, and like, oh, I get blood work back, like I'm immediately expecting an update from the nurse or the doctor, and that's just not the case because there's 100 patients in the ER at any given time and about 15 of us, and there's no way that we can possibly be everywhere all at once. So I would honestly say that expectations of patients and their families and the care that they are expecting to get constantly being measured against the reality of being extremely short staffed and having these very, very high expectations, and physically not being able to deliver on that is extremely stressful for all of us. When you work in healthcare, like you're 90% of the time, especially in the ER, you're dealing with people on some of their worst days of their life, right? Either themselves or their family member is sick, or worse, and they don't want that to happen. And tensions run high, and emotions run wild. And part of your job as a nurse is to help navigate that in the most healthy and I don't want to say positive, but therapeutic way possible. And I would say that one story that always sticks in my mind, which I think 99% of my colleagues would have always had just like this awful memory of it, that I look at, and it's very sad. But I was dealing with this one patient who was like very, very sick. He lives in a group home, doesn't have control of his own limbs, things like that. And like, he can't swallow pills. He has a tube in his stomach that they give for medications. And just like one of those really, really awful living situations that I remember he came in, I was taking care of him. The mom and the home aide was there like for the first 6 hours that he was there. Didn't say anything to me about any home medications. We're just like, they were very nice. They were thankful, thank you for taking good care of him, yada, yada. Then dad comes in when they leave and is freaking out about how we didn't give him some anti-seizure medications that he was supposed to get at noon, and now it's like 4:30 at this point, and he gets them every 6 hours. So I'm telling dad, I'm really sorry. Nobody told me he was supposed to get these medications. I'll talk to the doctors right now, and I'll see if I can, like, we'll get him the dose maybe an hour early for the next one, just so that we can try to keep up with it. And he is hounding me to the point where my boss's boss had to come down to talk to him and calm him down. And he's like going in circles, talking about, I don't care what you do. I wanted him to get those meds hours ago. And he's hounding me, and he is like belittling me the whole time, and he is just digging into me. And I'm like standing there like, I don't know what, I'm trying my best to communicate to you. I'm trying to talk to you. I'm trying to tell you, let me help make it better. Like, there's nothing I can do about this medication from 5 hours ago. I don't know what you want me to do. And every time I try to like refocus on let's do the right thing now, he's hounding me on how I screwed up and blah, 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 blah. And that's just, one of many examples of like when something like that happens. But, it's extremely stressful because like I have 7 other patients that I have to be taking care of. And I'm stuck dealing with that one thing where the request is, outside of time travel is impossible, And it's obviously just due to emotions and stress that I'm doing my best to help manage for him. That is obviously just kind of going nowhere.
Yeah. What changes would you like to see in the healthcare system that could ease some of the pressures?
I think in some level of improvement of the outpatient medical facilities, because right now I think you're seeing so much of an emphasis on and like stress and weight bearing on the emergency rooms and the hospitals in general, because I have abdominal pain, but it's going to take me 3.5 months to get in to see my primary care physician. Or worse, if I have a follow-up appointment with gastroenterology, it's going to take me 9 months to get in there. Why the hell am I going to wait 3 to 9 months when I can go to the ER right now?
Mm-hmm.
I think, honestly, I think that would probably be the biggest thing, and I don't know the right solution, but in some way, shape, or form, more of like an infrastructure or development or staffing or whatever of these outpatient facilities where we can like appropriately help see patients with non-emergent needs in an outpatient setting and not just be told immediately you're going to the ER because we can't do blood work to see immediately what's going on.
Mm-hmm.
I can tell you firsthand that having a good ER team, and that's everybody, that's from like housekeepers to like the nursing assistants to the other nurses to the residents to the attendings, like that's every single person that is a worker in that hospital that works with you day in and day out. Having a good team of people that are not only committed to like the same goal and vision that you are, but like just to speak plainly, like give a damn about like doing the right thing is like by far the greatest support system that a nurse can ask for. Because I've worked, when I did my traveling years ago, I did work in hospitals where that does not exist, and it very much feels like the doctors and the nurses do not see eye to eye. The doctors did not respect the nurses. Like the CAs just did their own thing. There was no communication. It was just, you're a nurse, you show up, you give a few meds, you beg a doctor to come look at a patient who looks like crap, and maybe they do, and you just clock out and you go home. And that was awful. That was like some of the worst. That was like some of the worst experience I've ever had in my life as like a professional RN. That sucked.